Now bringing health care to an often forgotten population. 1 out of 3 of those newly eligible for Medicaid under the Affordable Care Act are expected to be former inmates after their release from prison or jail. It's a story that hasn't gotten a lot of attention, but it represents a big change. Sarah Varney of the Kaiser Health News collaborated with the NewsHour on this report.
When inmates in California and around the country are released, most leave prison or jail with no health insurance and little access to medical care. But that's beginning to change.
The federal health care law encourages states to expand Medicaid to include all poor single adults, not just those who are disabled or who have children. Although Medicaid won't cover medical care for prisoners except for longer hospital stays, public health experts say the change in the law represents an unprecedented opportunity for ex-offenders when they get out. In fact, several studies have shown that ex-inmates who have access to health care when they leave jail, especially mental health and substance abuse counseling, are less likely to reoffend. But not everyone supports extending Medicaid benefits to those who have done time. The subject recently stirred debate on the Fox News program Fox and Friends.
I think a lot of those people who work hard and play by the rules and are paying their taxes and paying their insurance bills say, hey, I was told that this was about helping people with pre-existing conditions. I wasn't told that it was supposed to be about helping ex-convicts and people coming out of prison.
Avik Roy is a senior fellow at the Manhattan Institute, a conservative research group. While Roy agrees that access to health care reduces recidivism, he says access to Medicaid hasn't been shown to stop criminals from reoffending.
As much as we might intuitively think that this could be a way to address this problem, thus far it hasn't been. The way that Medicaid has evolved over the last 50 years have made it very ineffective because a lot of physicians don't accept Medicaid and don't see Medicaid patients. As a result, it's very difficult for Medicaid patients to get access to needed care.
19 states, many led by Republican governors, have chosen not to expand Medicaid over concerns about cost and federal overreach. Another 5 states are still debating their plans.
Our partners at Kaiser Health News have more reporting on how the numbers of mentally ill behind bars have grown substantially. You can find that online.